Hi, this is Curtis Alexander. I'm a pharmacist. Today's video we're going to talk about Vyepti. Before we do that, real quick, give me a thumbs up, hit that like button or subscribe. Let me know how I'm doing if these videos are helpful. So Vyepti is one of the newer migraine medications. It's in a similar class to some of the newer ones, but it's used a little differently, and we'll get into that. So first things first, I already mentioned it's used for migraines. One of the unique things that Vyepti brings to the market for people with migraines is that it's used to prevent migraines. But it can also, they're looking at using it for treating migraines like right away. And I'll explain a little bit in how that works. So as far as its class, it's part of the CGRP. So your Aimovig, your Emgality, your Ajovy, those are all CGRPs. And CGRP, what we call them CGRP, it's calcitonin gene-related peptide, but they block basically an enzyme or a protein in the body that can lead to inflammation and migraines. So it's part of that class. What makes it unique is the fact that it's an infusion. So how it's given is IV. You have to go into the doctor's office, the infusion center, sit down and get an infusion. Now there's pluses and minuses to doing that. With the other medications, you can either take them orally or subcutaneously. The preventative ones you take subcutaneously, which sounds good, and it is good because you can do it at home at your convenience. An infusion is less convenient. However, there are some advantages to it. So first of all, the infusion should take about half an hour, so it's not a long time. The other advantage of doing an infusion, whereas the subcutaneous is normally once a month, some of them you can do every 3 months, but the infusion is truly every 3 months. Now, one of the things we see, actually I'll get into that in a second. So it's more of, for some people it can be an inconvenience, others it's not a big deal. Just know that it's an infusion and you're going to have to plan for that coming into the office every 3 months. So what about side effects? The biggest side effect concern that we have is, again, we come back to this concern about antibody development. A lot of these new injectables, and it can be some of the migraine injectables, some of the rheumatoid arthritis injectables, a lot of these newer biologics can lead to the same problem of antibody development. Essentially what's happening is you inject this into your body sees it, it begins developing antibodies to it, and that can be why we see effectiveness of these drugs go down over time. Now, what can happen in extreme cases is you can develop neutralizing antibodies. And in about 35 to 41% of people, again, this is in studies, this doesn't mean it's going to happen, but there is a range of people that if they develop those neutralizing antibodies, the drug is just no longer effective for them. So that's the biggest side effect. That's the biggest concern we have. Outside of that, it's very well tolerated. The most common side effect is sometimes people can get nasopharyngitis, which is essentially cold symptoms, runny nose, stuffy head, that kind of thing. Other people can, 2%, experience a little bit of nausea, but again, very well tolerated outside of the antibody development. Always get asked weight gain, hair loss, so I like to touch on it. With Vyepti, it doesn't appear to be a concern. It's not reported in the literature. So I think the big thing to take away from Vyepti, because it's an infusion, that's good for some people, bad for others. In my opinion, Vyepti would be a good option if you've tried other subcutaneous migraine medications and you find that they wear off a little bit at the end of the month. You have anywhere from 3 to 4 days to a week of time where maybe you're getting more headaches, more migraines. Vyepti would be a good option because it's every 3 months, so it's going to cover you longer. And we find that it really does do a pretty good job of covering people for those 3 months unless they develop antibodies. So again, whether it's an injectable migraine med or you're getting Botox injections to deal with migraines, one of the side effects is they can wear off a little bit at the end of the injection period. Vyepti is a good option if you fall in that camp. The other thing is, say you have a sales job and you're traveling a lot and you don't want to remember to take pens with you and maybe have stuff wear off and it's an inconvenience. If you can put up going into the office once a quarter, once every 3 months to get a half-hour infusion, Vyepti would be a good option. And again, because it's intravenous, they use it to prevent migraines. That's what it's indicated for. But I do know that the drug company is looking at trying to use Vyepti in emergency rooms for somebody who has a migraine right now, because the other advantage of Vyepti is you can see results within a day. I mean, it's obviously in your system right away, and some people experience results quicker, but you can almost tell people like in a day you should be feeling better, this should be taking effect. So they're looking at it for treating migraines right now as well. So something to keep in mind. Again, Curtis Alexander, this was Vyepti migraine medication. Anything in the comments that you have questions on, other topics you need me to cover, please let me know. Appreciate you listening. Till the next video, thank you.